Welcome back. You're watching In Focus, and it's time now for our Africa Health Network update.
And health reporter Linord Moudou now joins us to tell us more about treating malaria. Hello, Linord.
Hello, Vincent.
Hi, Linord.
Hello, Dimiake. Hello, everyone. Well, we start in the Central African Republic, where a community-led anti-malaria project is making a difference in the lives of people living in a small village. Here, in the Central African Republic village of Obo, a silent battle is being waged every day. It is the fight against malaria. The mosquito-borne disease is the country's #1 killer among children and young adults. The United Nations says the infant mortality rate in the CAR is 173 per 1,000 live births. Inadequate infrastructure, compounded with a lack of skilled healthcare practitioners, increases the spread of the disease.
The lack of medical staff is our main problem, especially since the tragic death of our base surgeon. Basically, the population of Obo is at the mercy of severe malaria.
Another pressing problem is access to medicine, which is expensive and difficult to distribute to remote villages like Obo. The local pharmacist says it's painful not being able to help the people.
It's a pity when someone comes in and we just stand here saying we have no medication to offer them. It's shameful to come and stay here all day without anything to do.
Until recently, residents of Obo had to rely on traditional medicine to provide some relief for the deadly disease.
When a child got sick, I used to collect herbs and boil them. I would prepare him a fumigation and I would treat him with lemongrass too. And when it didn't work, I would bring him to the hospital.
The International Committee of Red Cross is carrying out a pilot project in the area that aims to increase early diagnosis and swift treatment of the disease. Local healthcare practitioners are being trained to administer malaria tests and distribute medicine as they travel from village to village, providing free treatment. The new approach is starting to yield tangible and positive results, significantly reducing the mortality rate in some villages. Now to East Africa. A group of Kenyan software developers in Nairobi have developed an application that they say helps in the early diagnosis of malaria. Elvis Bando is an information technology graduate who, along with a group of medical students, created the mobile-based application known as Zahanati. As millions of people access medical information online, Bando says self-diagnosis is sometimes counterproductive.
The background of the app, it was after the realization that most people do self-diagnosis. When I am sick, first thing I go online, I check whether whatever the symptoms I have are related to a certain disease or something like that. I think this is one of the challenges for malaria because people are doing a lot of self-diagnosis.
Bando says the Zahanati, which is still being tested, will be interactive, unlike most internet websites, and involves data collected from local medical professionals who better understand the disease. The Zahanati users will send a list of their symptoms via text message to an interactive database that will reply with a set of questions to determine a preliminary diagnosis. Experts say early detection of malaria goes a long way in treating and curing the disease.
What the app does is looks at the data that you have supplied and checks back at what the doctors gave us. The back end has a lot of data for malaria. So are these symptoms correlated? And then gives you that diagnosis. It's I would think it's more authentic because it runs on actual prescription.
Besides early diagnosis, the application also helps researchers map areas where malaria is prevalent. Using that data, health officials can concentrate the distribution of preventative materials and measures throughout the country. Malaria infects more than 200 million people worldwide every year and kills some 600,000 people, most of them children under the age of 5 in sub-Saharan Africa. Malaria is transmitted by the female Anopheles mosquito, and researchers are constantly looking for new ways to tackle the disease. The use of telecommunication and information technology, commonly referred to as telemedicine, is becoming widespread in affected countries. Zahanati is not the first telemedicine application to be tested in Kenya. But some experts are questioning the viability and reliability of such methods. Dr. Ian Kamuri is a consultant at Nairobi's Kenyatta National Hospital, and he warns that telemedicine should not replace face-to-face consultations.
Telemedicine cannot substitute a trained personnel. We are talking about an aid to a gadget that facilitates, a system that facilitates, but it is not the ultimate. For example, you can't diagnose malaria by just saying, I'm having weak joints, I'm having fever, I'm feeling, I had traveled to Kisumu or I had traveled to Western. That cannot be a criteria for diagnosing malaria.
While existing prevention measures such as indoor spraying and mosquito nets treated with insecticide are still effective, experts say tighter surveillance and rapid response strategies are needed to prevent resistance. Zahanati's developers are advising their users that any diagnosis generated from the application must be followed by consultation with a doctor.
And that's all for today. Vincent Dimiake. Thanks so much, Linord.
Sure.
Interesting report.
Thanks a lot. And be sure to watch Linord Moudou's Africa Health Network reports every Tuesday and Thursday right here on In Focus.
And we're going to take another short break. Or rather, for more information on the Africa Health Network, please be sure to visit our website, africahealthnetwork.com.